The criteria to use barbiturate the patient with a glaucoma scale of less than 7. If the ICP greater than 25 mm mercury at rest for 10 minutes. Failed maximal intervention that including drainage of CSF, mannitol, analgesia and sedation. بهاي الحالات احنا بنقدر نستخدم الباربيتوريت كوما. Used for less than 72 hours. The following should be provided before barbiturate. Secure airway with mechanical ventilator, intracranial pressure, blood pressure, cardiac and patient monitoring, ECG monitoring and EEG monitoring, electroencephalogram. We have to discontinue the barbiturate and start weaning over 24 to 72 hours. The arousal is gradual and prolonged even when a blood level 0 for several days. And then we have to start weaning from mechanical ventilator. Blood pressure management. Antihypertensive to maintain effective cerebral perfusion pressure, because when there is a hypertension there is a severe vasoconstriction that decrease blood flow to the brain by vasodilator drug. Seizure prophylaxis should be considered with patient with increased ICP, like phenytoin and carbamazepine. For acute onset seizure, diazepam اللي هو الفاليوم. Put patient on his side, auto mask applied, glucose test ordered, and EEG monitoring. Hypothermia to decrease the metabolic demands. Controversial, لكن could be used to limit by service cooling and IV cooling devices. Position head and neck in a neutral position, no flexion, no extension, no rotation. The head should be elevated 15 to 30 degrees to promote drainage. Flexion of the hip greater than 90 avoided. Avoid extreme rotation of neck. In addition, avoid straining during defecation because it increases intra-abdominal pressure. Before suction, provide hyperoxygenation for the patient and avoiding any emotional distress. Also, as a patient with ICP, there is ICP waveform and reading. The ICP couldn't appear on the monitor. The causes and the management if the wave did not appear on the monitor. This could be due to air between the transducer, diaphragm, and pressure source. Eliminate the air bubbles with a sterile saline solution. Could be occlusion of intracranial measurement device with the blood or the prize, so that flush intracranial catheter or screw as directed by physician using 0.25 ml sterile saline solution. Transducer connected incorrectly, so that a correct connection for the transducer should be applied. Fiber optic catheter pent انتناء في الفايبر optic catheter. Replace the fiber optic catheter. Incorrect gain setting. Adjust the gain setting for the device. Trace turned off. Turn on the power for the trace.